Hello again, this is Daryl. I'm on my journey to have my eyeball removed and healed, and I'm got a couple other things that need attention also. I had a couple aneurysms. I've got one in my heart and one in the back of my skull at the base. And I had an angiography done for the one on the back of my skull. And I had to lay flat on my back for about 5 hours total, 45 minutes to an hour before they took me into the x-ray room. And then after they were done, it took about 30-40 minutes for the procedure. And then for about 3.5 hours, I had to stay flat on my back so I wouldn't bleed, I guess. Not quite sure of all the reasons for it, but they went into an artery with a tube and they injected dye, and then they took x-rays of my skull to find out what size of a apparatus they needed to order when they do my surgery. Well, my eye surgery is due the 27th of this month of January 2025. It's January 13th today. And I'm doing this video to let you know that it's really hard, to give up something, an arm or a leg or an eye or a foot or even a partial finger, to lose something like that. It's permanent. And I've had 3 months to sweat this out, to get used to the idea that I was losing my eye. And it's a hard thing. I don't really have a choice. I've got cancer, basal cell carcinoma cancer in this eye. It's pushing up on my eye, causes me to have headaches up in here and in my eye. And I'm taking a lot of Excedrin. It's what I take for aspirin. It works, but it only lasts for 4 to 6 hours, and then I'm either stay in pain for a while or I take some more. And I've only got a short time now before the surgery. Things we've got a room scheduled in Washington where we're going to have this done, Washington State, and it's right near the hospital where my wife can stay with me. And I'm going to be there for it's about 6.5 hour surgery, and then I'll be in intensive care for a couple days, and then I'll spend 3 or 4 days in a room and to recover from that before I can come home. I live in Idaho, so it's going to be a trial, an ordeal, and it's hard to get used to something like that. You don't want to lose your eye. You don't want to lose anything. But sometimes you have to make decisions that aren't easy, and this is one of them for me. I'm 71 years old, had my eye for a long time, both of them, and I've seen a lot of things, done a lot of things. Now I've got to get used to using one eye, and they tell me, oh, you'll get used to it. Oh, you can drive again. You can, your vision will be fine. You won't even know it's missing after a year or two or whatever. That's easy to hear from people that have eyes, and even somebody that would tell you that lost an eye. But when you're on this side of it, before it happens, it's hard news to take. Right now, I see double vision with my eye. This won't heal. This redness you see has been there for months. And my eye, if you look at my pupils, this eye is raised up, and they say that there's a cavity here underneath the eye with a tumor that's pushing the eyeball up. Well, they're probably right. That's the way it looks. So I'm going to end up going through this surgery pretty soon now, and I'll try to fill you in on how the healing goes, how the procedure went, and what you go through with something like this. Sometimes it's easier after it happens because it's over with and you know you're healing and you can talk about it easier. But right now it's a little difficult, and I'm doing this for anybody that's having to go through something like this, an amputation or losing an eye or any tragic thing like this. I know I'm not going to live forever, and if I knew this wouldn't cause any problems for another 5 or 10 years, I wouldn't even mess with it. But they tell me it can take your life if you don't take care of something like this. I want to be around for my kids and my grandkids to enjoy watching them grow up a little and have them enjoy being with me. And that's why I made the decision to go ahead and get this done. Well, I won't take up any more of your time. I'll be making more posts as the time gets closer to surgery or right after surgery. Maybe send you a couple pictures. So have a wonderful day. God bless you, and thanks for listening.